Today we will be discussing hypothyroidism. Please pay attention.
The thyroid gland is an endocrine gland, located in the middle of the lower neck. It is shaped like a butterfly, as you can see here in the picture.
It releases thyroid hormones that regulate the body's physiological functions, such as triiodothyronine, known as T3, and thyroxine, known as T4.
T3 and T4 are regulated by another hormone released from the pituitary gland called thyroid-stimulating hormone, TSH, which is regulated by thyrotropin-releasing hormone, TRH.
They help regulate the body's functions such as breathing, temperature, metabolism and heart rate. When the thyroid gland is underactive, it results in hypothyroidism. Primary hypothyroidism results in high TSH, low TT4, low FT4 and positive TPO and ATG antibodies. When the pituitary is not releasing enough TSH, it is called pituitary insufficiency, and results in low TSH, low TT4, and low FT4.
More than 12% of U.S. population will develop a thyroid disorder during their lifetime. An estimated 20 million Americans have some form of thyroid disease. Up to 60% of those with thyroid disorders are unaware of their condition. I can't believe this. Can you? Women are 5 times more likely than men to have thyroid problems in their lifetime. 1 in 8 women will develop a thyroid disorder during her lifetime. According to the American Thyroid Association, adults over 35 years of age should be screened for thyroid disorders every 5 years. So, what are some causes of hypothyroidism?
The most common causes of hypothyroidism are 2. The first one is iodine deficiency. And second, Hashimoto's disease, which is the most common cause of hypothyroidism.
Do you know what Hashimoto's disease is? Hashimoto's disease is an immune system disorder, where your body's immune system attack its own thyroid gland, resulting in hypothyroidism.
Other causes of hypothyroidism are thyroiditis, which is an inflammation of the thyroid gland; congenital hypothyroidism, which is hypothyroidism present at birth. Other causes of hypothyroidism include surgical removal of part or all of the thyroid gland, radiation treatment of the thyroid, and some medications. Some medications can interfere with the thyroid hormone production and lead to hypothyroidism. These medications are amiodarone, interferon alpha, lithium, interleukin-2, a medication for kidney cancer, and most importantly, thymines, used for hyperthyroidism. So, how do you know when to suspect hypothyroidism?
Hypothyroidism signs and symptoms vary, and they can be confused with other health problems, but the most common signs and symptoms are intolerance to cold, excessive weight gain, constipation, muscle cramps, dry hair and skin, hoarseness, bradycardia, dull facial expressions and others. Keep in mind that there are future consequences for hypothyroidism that may not appear right away, and they are an increased risk of total cholesterol, LDL, and triglycerides, an increase in atherosclerosis and myocardial infarction risk, also, an increase in miscarriage risk, and impaired fetal development. My friend will take over to tell you about the available treatment options.
There are 3 hormone replacement therapy used to treat hypothyroidism, and they are levothyroxine sodium, liothyronine sodium, and thyroid tablets known as Thyroid.
Levothyroxine is the synthetic version of thyroxine, T4. Liothyronine is the synthetic version of T3. And amyothyroid is a freeze-dried porcine gland that contains T3 and T4.
Thyroid replacement hormones are usually well tolerated. Symptoms that may occur may be due to a high dose of the treatment, and can easily be adjusted by your doctor. For your safety and treatment effectiveness, don't forget to ask your doctor or pharmacist about drug interactions, and give them the names of medications that you are taking. That's all for today. Thank you for watching. Special thanks to Dr. Unger.